ED workflow and dynamic documentation. In an effort to improve provider satisfaction, workflow, and communication with primary care providers, there are two new items in eCare: ED workflow and ED provider documentation. After opening the patient's chart, select ED workflow from the menu. The ED workflow review page provides a consolidated view of information contained throughout the chart. It is interactive with views of real-time clinical information and supports both single and multi-patient views. The ED Quick Orders tab provides the physician a quick way to select common labs, radiology, medication, and power plans. The workflow review page is customizable to change the layout, drag and drop the sections into a different spot, expand all sections, hiding components, or adding folders to your view. In the event that you do not want to see any of the tabs at the top, you can click the X in the corner of the tab and it will be removed. To add the tab back in, click the plus sign. The ED Note Workflow tab contains a variety of helpful components to display information from throughout the EMR in a single, easy-to-use, and customizable place. In addition, many components offer quick ways to manage patient information. Dynamic documentation efficiently pulls data from the patient chart, for example, allergies, medications, orders, and vital signs, and allows providers to type, use auto text, or drag in any free text field for flexible and efficient clinical documentation. If you'd like to learn more about these components in detail, please refer to the Intro to Dynamic Documentation video located on the intranet in the Provider section. The functionality of the split screen view allows the provider to split the ED Note Workflow tab into two columns. In this view, one or more free text components can be displayed in the right column, and the rest of the components are displayed in the left column. This allows the provider to scroll through the information on the left while documenting in the components on the right. All the components needed to discharge your patient are in the ED Discharge tab. By completing each of these fields, the information will flow into your note and you will have minimal work to do to complete the discharge process. To open provider documentation to create your note, you'll need to select the Select Other Note tab. After clicking Select Other Note, you will have the opportunity to select the required note type and the note template before starting your note. The note type selected will determine which folder the note is filed in the Documents section of the chart. If you would like to add a note template to the Favorites tab, click the star in front of the template, turning it yellow. To remove a note template from your favorites, click the star to turn it white. There is functionality to set your note type as a default, so every time you open a note, you will not have to choose it each time. To set your default note type, select View from the toolbar and then select Customize. In the Customize window, click on the black drop-down arrow in the default note type field and scroll until you see Emergency Department Note Provider. Select this note type, click Apply, and then click OK. Selecting the appropriate template provides you with a note that will pre-populate relevant patient information and provide a free text field to dictate a narrative of the patient's ED visit using drag-in, auto text, or typing. Double-click on the note template to begin documenting, or select the note template you want to use and click OK. The body of the note will hold information that is pulled in via Smart Template, and also any dictation that you may have done in the Workflow Review free text fields. Some of the Smart Template fields will have the ability to be refreshed, add in a free text field, or deleted from your note by hovering over the field and then clicking the appropriate icon. If the note is not complete and you need to leave the patient chart, select Save or Save and Close to return at a later time. Please note that once a note template is saved, it is published and viewable in the patient's chart. The St. John Providence policy is that all saved notes must be signed and finalized within 24 hours. If the note is complete and you are ready to sign, click the Sign Submit button. After clicking the Sign Submit button, a smaller window will appear to review the note type and title for accuracy. In this screen, you can forward your note for signature or review to a provider by searching for their name in the provider search window. You can add providers to your favorites by clicking the star in front of their name as well. Once you have reviewed that the type and title are correct, please click Sign to finalize your note. After signing the note, you will be directed back to the ED Discharge tab in the Workflow Review. In this tab, click on the Checkout component to view the 4 fields that will need to be completed. The completed fields will be noted with a check mark in the circle. Once these 4 fields and your note are completed, click on the door icon in the upper right-hand corner. After clicking the door icon, you'll be directed to the Depart Process screen with all the information you've completed filled in. Once you complete the necessary fields, the patient can be discharged. To view the list of patient documents, click on the ED Provider Documentation tab from the menu. The list of notes for this patient will show in this window, with signed note showing as a final report and saved note showing as a preliminary report. You will also have the ability to forward any note to another person, as well as modify in error your own notes. If you'd like more detailed information about dynamic documentation, please review the Intro to Dynamic Documentation video that is located in the Provider Education section on the St. John intranet. Thank you for viewing the ED Workflow and Dynamic Documentation training video.